There's a lot of studies looking at immunotherapy in the metastatic setting for patients with gastric and esophageal cancer. But there's only one, to my knowledge, a large phase 3 in the adjuvant setting, which is open globally, called CheckMate 577, sponsored by Bristol Myers Squibb. The design of the study is quite simple, really. The way we normally treat these patients is we give chemoradiation for 5 or 6 weeks, and then a number of weeks later, when the patients have recovered, they go for surgery. This is in patients with stage 2, 3 esophageal or gastroesophageal junction cancers. The problem we have in standard of care is when patients don't achieve a pathological complete response, we don't know what to do with them after surgery. Should they get more treatment? Should they get chemotherapy? And the problem is there's no data. So what we designed this study was to give immunotherapy after patients have had the standard treatment regimens. So in the 75% or so of patients that don't achieve a pathological complete response, we're randomizing 2-to-1 to either get Nivolumab, which is the PD-1 inhibitor, or standard of care, which is close observation. And so this is a phase 3 randomized study. It's open in over 170 sites in over 34 countries, and they're looking to enroll 760 patients. So this study's been open now for about a year. It's accruing well. It's going to take another year or two before we finish the study, and then we start seeing some results. So it's a very exciting study. If it's a positive trial, of course, we'll have to wait and see, but that would be a new addition to help our patients prevent metastatic disease from happening, which, as I said, there's so many studies in the metastatic setting. We're now moving these drugs into the earlier stage to try and prevent patients from developing more advanced cancers.